And the actual initial title was an approach to the study of patients that complain of hair loss. It is not the study of anybody that has hair loss, but somebody that complains of it. There is a difference. And you will see what the difference is as the talk goes by. This has the co-authorship of Dr. Franco Arcia, who helped with the preparation of the talk, and is a dear friend and congressman. This course is limited to diffuse hair loss. A patient that comes and says, I'm losing hair. We don't do these studies to anybody that comes and says, I'm losing hair. The woman comes, I gave birth to a child 3 months ago and I'm losing hair. I don't do that. Say, you know, stay at home, come back in 3 months and we'll see. A man comes and has a pain like I have, or even worse. Not necessary. It's somebody that comes and you see two things. Either that there's a question whether this patient loses hair or not. Two, if there's a question, what is the reason for losing hair? And three, is losing hair something very important to that patient? Therefore, I do these studies not many times a year. I'm doing this since 1977. I have 692 studies, which goes about one study a month. This is what I do. Now, when the patient comes to you, you talk to the patient, you see the patient, you see the body language of the patient, and then you give him instructions. Count the hairs that fall daily for 5 days. If this patient does that, he or she is interested. Bring the hairs that fall off in 48 hours and put them in a small, transparent plastic bag. This is very important because these hairs are to be looked at the microscope. Bring a list of the medication that you take or have taken the last year. Write an autobiography. See instruction sheet. There's a sheet how to write an autobiography. You see how important that is. Do the following laboratory tests. Oops, sorry. Okay, complete blood count, ferritin, serological test for syphilis, sedimentation rate, rheumatoid factor, urea, creatinine, fasting blood sugar, study of thyroid, urinalysis, HIV, prolactin, dehydroepiandrosterone, total testosterone, protein-bound testosterone, free testosterone. Other tests depends on the patient. This is a lot, but this is what the minimum that you really need. Make an appointment for a trichogram. Trichogram is what we'll show. Make an appointment for a biopsy. We don't do the biopsy routinely. Actually, we seldom do it anymore. But in some cases, we do a biopsy. We generally don't do a biopsy unless it's absolutely necessary. What is a familial trichophenotype? Starting from grandparents. I mean, how was the hair of your grandfather, your grandmother, the other grandfather, the other grandmother, your uncle, etc. Most of the time, the patient will not know all of it, but some say, you know, a lot of old people in my family. Oh no, my mother had a beautiful head of hair. Additional instructions. There are additional instructions. Writing an autobiography. This is a key point. The autobiography is to provide the physician with information that will allow for a more efficient and quick interrogation. These patients are not everybody's patients. They come for a reason, as I said before at the beginning. So, unless if I am a psychoanalyst and I have an hour for every patient 3 times a week, this would be necessary. But I don't. So I look at the autobiography, which is given to me before I see the patient, days before. I study the autobiography, and from that autobiography, I start asking questions. It is not the first visit, but it's the last visit, the final visit before the patient leaves and then comes back 2 or 3 months of that. And questions are made, and you will see how these questions are made. The autobiography will be written by hand in white online paper. Use ink or ballpoint pen, do not use pencil, because I do a graphological analysis of the autobiography. So, and if the patient does not obey these instructions, if he or she types it on a computer or writes it on a line paper or writes it, then this is a certain kind of personality that does not obey instructions. So this is, even that is very important. Okay, I ask you to do this and you bring me a 10-page computer typed autobiography. This is important too. The length of the autobiography depends from you. Try to be as complete as you can. You can have an autobiography of 10 pages and you can have one of half a page. And it's very important, not only what the patient writes, but what the patient does not write. Assume a 50-year-old woman married with 3 children doesn't say a word about her husband. Or the contrary, man doesn't worry about her wife. This is very important. How's your wife? How does she behave? Inform about the diseases that you've had, your relationships with immediate relatives, your friendships and love relations. Include conjugal relations and interaction with your children. Put this material in a sealed envelope with your name. Some patients ask that this be given back to them. I mean, okay, you want this back? Here it is. No problem. Most of the patients do not. This is an autobiography. Look at this. These arrows and underline are mine. This is a complete, look at this. It's like wave, a sinusoid kind of line. Letters are small. Capital letters are small. It's a person who is disorganized, uneasy, with little self-esteem. Aquí dice, salí del closet y admití que soy gay. I came out of the closet recently and admitted I am gay. Mis dos padres y tíos no lo aceptaron bien. Mis hermanos y amigos sí. Parents didn't accept. His brothers and friends, yes. En mi familia, todos son calvos. There's a lot of baldness in the family. This man is not coming because he's bald. He's coming because he has poor self-image and low self-esteem. He may become bald. He may need treatment for baldness, but the important point is not his baldness. This is another autobiography, another person. This is a woman. I think that she wrote over lines because it's extremely straight. Very well organized. Capital letters are of fair size. Soy una persona que siempre está estresada y nerviosa y mi humor varía mucho, aunque también me gusta reírme. I'm a person that is usually stressed and nervous, and my state of mind changes very much, although I also like to laugh, go out, do exercise, and try to relax, try to relax, try to relax. That is a person who is stressed, tense, and she has migraine, migraine. Mi mamá al verme
So, and she also was, and she had a hole in the hair, but it was not alopecia areata. I consider myself a person who is a little bit weak. And then I went to become very sad. I cried every day. I cut my hair so to cover the hole which she said she had, which she did not have. You see how important that is? It takes time. It takes knowledge. You have to know how to do a morphological analysis. I like it very much. I've been reading on it for years. And it takes time. But it's value. It's full of value. It's very important. So how do you do it clinically? You pull hair from the scalp. This is the head of Francisco Franco, by the way. Normally I would do that. I mean, these obviously male pattern baldness. I mean, you put it into a petri dish with water, but it is a small petri dish, and it's a plastic petri dish. And then you put, this is the bottom of the petri dish, and then you put an inverted, the bottom of it, I mean, this is the top, and you put the bottom over it. So there is a chamber which is very thin and is full of water, and then you put this. You can keep this in the refrigerator forever, but when you want to look at this, I don't look at it during the day. I do this in the weekends. So you look at that with a polarized light microscope, and you look at this, and you see here a anagen hair. This is a hair which has been cut. And this where you will see a telogen hair. So you do a telogen anagen count. And these are very small. Oh, yes. These are very small, narrow hairs. These are mini hairs. This is a mini anagen hair, which is typical of androgen type of alopecia. This is the key of the objective analysis of the hair. Then you determine the percentage of anagen hairs, the percentage of telogen hairs, the percentage of catagen hairs, the presence of abnormal morphologies, and the presence and proportion of mini hairs, which gives you the basis for a androgen pattern alopecia. You can measure these hairs if you want. Then you have a hair piece with you can say how many microns there are, but this is not necessary. These are biopsies. The biopsies are not very good. I mean, the microphotographs. Franco took them in my office through the microscope with a telephone. I mean, but these are actually cases of lupus. And this one is like a crucial alopecia. I'm sorry. Go back, maybe. This is very sensitive. Okay. A few salient points. Interview with the patient should be unhurried and relaxing. If you are hurried, if your day is full, don't see that patient. They have a special appointment, and you have time for them. Ask pertinent questions based on result of tests. Okay, a patient has all these psychological characteristics, but this patient has Hashimoto's thyroiditis. This patient has low iron. This patient has other problems. This patient has polycystic ovary disease. I mean, you can have both things. This is not only about psychosomatic, it's also about organic. So you study the whole patient, and you treat the whole patient. Okay, this patient has TENS, etc., but this patient needs iron. This patient needs thyroid. This patient needs, there is a severe personality problem, and this patient needs a psychiatrist.
which kind